Do you know that diabetes is one of the major causes of kidney damage? Good day, everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Messi Mary, popularly known as the Nurse with a Difference, and I make learning easy and accessible for all my viewers. Today, I'm going to be sharing with you 4 causes of kidney damage and also the risk factors for kidney damage. But before we go into details into this class, if you are new on our YouTube channel and these are contents you are interested in, please click on that subscribe button, turn on the notification bell so you don't miss out. For all my returning subscribers, this is Nurse Mary saying thank you. Let's go there. All right, welcome back. Now, let's talk about the 4 causes of kidney damage before I talk about the risk factor. And the number one on the list is the one I already mentioned at the beginning of the video, and that is diabetes. I believe when you hear diabetes, the next thing that comes to your mind is an increase in the blood glucose level. So when there's an increase in the blood glucose level, definitely the blood going to the kidney is going to be high in glucose, it's going to be high in sugar. And having that, we all know that the kidney is a filter. It's made up of a filter that helps filter waste products. So having a lot of glucose going into the kidney, going into the filter, is like taking sand, sandpaper or something very sharp and scraping it on your skin. Definitely it's going to cause damage to the skin. So that is what that glucose is actually doing to the filter. It's doing to the glomerulus, it's doing to the kidney. It can damage the kidney if not properly managed. So if the sugar level in an individual is not properly managed, it can lead to the damage of the kidney, because that high sugar level going to the kidney is overworking the kidney. It's putting a lot of pressure on the kidney. It's not just the kidney that is being affected as a result of high sugar level, as a result of high glucose level. We also have the capillary endothelial cells of the retina, that's the eye. It's also affected. The mesenchymal cells of the renal glomerulus, I already said that. The neurons and also the Schwann cells of peripheral nerves. All these are affected as a result of diabetes. Then the second I have to share with you is high blood pressure. High blood pressure actually hardens the artery. It makes them narrow. It constricts the artery. And when the arteries are constricted, the kidney is not going to be getting enough blood flow. And we all know that blood flow is very important for all the organs in our body. It gives the organs in our body nutrients, it gives it glucose, it gives it everything it needs. But when these blood vessels are constricted, the blood flowing to the kidney is actually reduced, and that can result in kidney damage. So if you are hypertensive or diabetic, it is very important for you to stick to your medication regime. It's very important for you to manage it with the food you eat and also medication, so that your kidney does not get affected. Now that takes me to the third cause of kidney damage, and that is polycystic kidney disease. Polycystic kidney disease. This is an inherited condition where growth called cysts develop around the kidney. So if you're an individual that has this cyst, that has polycystic kidney disease, that kind of puts you at risk, or it can lead to the kidney disease. So you just have to make sure that you are in check. Always go for your regular checkup to make sure that everything is balanced and checked. Then the fourth cause I would like to share with you is glomerulonephritis. Glomerulonephritis. Glomerulonephritis is simply the inflammation of the glomeruli, the glomerulus of the kidney. We all know that the kidney is made up of different nephrons and is made up of different glomerulus. It has a lot of glomerulus and a lot of nephron. So when you're having glomerulonephritis, recurrent glomerulonephritis, recurrent pyelonephritis, this can actually put you at risk for developing kidney disease. It can also cause kidney disease on the long run. So these are the 4 causes I have to share with you. Then the next one I'm going to be sharing with you now are the risk factors. The risk factors are more or less like the causes. Diabetes puts you at risk, hypertension puts you at risk, smoking puts you at risk, excessive alcohol intake puts you at risk. Smoking and excessive alcohol intake actually overwork your kidney. Yes, they actually overwork your kidney. Obesity puts you at risk for kidney damage. We cannot overemphasize like the effect of obesity on our health. When one is obese, it actually makes their BMI high, and it's actually overwork the heart and the organs inside. So when these organs are overworked, for example, the heart is overworked, definitely the blood supply to the kidney is going to be impaired. So obesity puts you at risk for kidney damage. So if you are obese, sometimes I know it's not easy, it is easier said than done. It is important for you to try within your power to try and cut some fat to help gain a healthy life. So family history of kidney disease, if you have anybody in the family that has had kidney disease in the past or recently, that actually puts you at risk. Then abnormal kidney disease, abnormal kidney structure. If your kidney has any abnormality, when it was diagnosed that, oh, your kidney has one or two issues, that can put you at risk for kidney damage. Then as you grow older, your kidney gets weaker. Generally, as we all grow older, our various organs, our body gets weaker. We are not able to perform effectively well. Same way your muscles get weaker, same way your skin gets wrinkled, that same way your kidney has been affected. So as you get older, you're at risk of going down with kidney disease. Then the last one I have to share with you is frequent use of medication. There are some medications that put strain and stress on the kidney because some medications are being excreted out by the kidney. So if you use medications like without proper prescriptions, you're on some particular medications, they can put you at risk. For example, the ACE, angiotensin converting enzyme inhibitors medications that are used to treat high blood pressure and heart failure. These particular medications are excreted by the kidney, and that also puts you at risk of going down with kidney damage. So these are the little causes I would like to share with you in regards to the cause of kidney damage. In my own perspective, what I have to give, my general advice when it comes to taking care of your kidney, try as much as possible to eat healthy, try as much as possible to take a lot of water. For me, I find it difficult to take a lot of water. So what I normally do is have a blend of fruit. So most fruits contain higher quantity of water. They contain a lot of water. For example, watermelon contains more than 90% of water. You can see just few percent are really hard. What is there is water. So if you find it difficult to take more of food, you can be taking blends of smoothies. That is going to help increase your water intake, because the more you water intake you take, the more your kidney is able to have this less stress and strain of working harder. It's more or less like having concentrated urine and also urine that are not concentrated. The more concentrated your urine is, the more work your kidney has to do. So you have to take a lot of water to help reduce the risk of going down with kidney damage. It makes the kidney work less. Let's put it that way. Yes. So thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Bye and see you in our next video.